This is My Child Will Thrive, and I'm your host, Tara Hunkin, nutritional therapy practitioner, certified GAPS practitioner, restorative wellness practitioner, and mother. I'm thrilled to share with you the latest information, tips, resources, and tools to help you on the path to recovery for your child with ADHD, autism, sensory processing disorder, or learning disabilities. My own experiences with my daughter, combined with as much training as I can get my hands on, research I can dig into, and conferences I can attend, have helped me to develop systems and tools for parents like you who feel overwhelmed trying to help their children. So sit back as I share another great topic to help you on your journey. A quick disclaimer before we get started. My Child Will Thrive is not a substitute for working with a qualified healthcare practitioner. The information provided on this podcast is not intended to diagnose or treat your child. Please consult your healthcare practitioner before implementing any information or treatments that you have learned about on this podcast. There are many gifted, passionate, and knowledgeable practitioners with hundreds, if not thousands, of hours of study and clinical experience available to help guide you. Part of our goal is to give you the knowledge and tools you'll need to effectively advocate for your child so that you don't blindly implement each new treatment that comes along. No one knows your child better than you. No one knows your child's history like you do or can better judge what is normal or abnormal for your child. The greatest success in recovery comes from the parent being informed and asking the right questions and making the best decisions for their child in coordination with a team of qualified practitioners in different areas of specialty. Now on with the show. Hi, everyone. I want to welcome today to the My Child Will Thrive podcast, Dr. Christina, and I'm going to hopefully say your name correctly. Is it Bjorndal? Bjorndal. Sorry. It's a tough one. Dr. Chris is an authority in the treatment of mental illnesses such as depression, anxiety, bipolar disorders, and eating disorders. And having overcome many mental health challenges herself, Dr. Chris became a gifted speaker and writer who loved to share her philosophy of wellness in interviews with icons like Jenny McCarthy and many more. She's recognized as one of the top naturopathic doctors to follow by 2 independent organizations, and she's helped many patients achieve physical, mental, and emotional and spiritual well-being. She's completed 3 books on mental health, as well as a 10-week course and an in-person retreat on mental health that you can engage in with her. And I invite you, after you listen to this interview, to visit her website, which will be linked in the show notes on the website at the end of the show. Dr. Chris, thanks so much for joining me here today. I've had the pleasure of meeting you at some conferences over the past year, and I love both your story, but also how you became a naturopathic doctor, but also I'm very intrigued by your book, Beyond the Label. So why don't we start by talking about how you got started out as being a naturopathic doctor?
Yeah, so I like to make sure that people understand that I haven't always been a naturopathic doctor. And prior to being a naturopathic doctor, I was in the corporate world. What really brought me to make this career change was my own journey with my health. And that actually started back in high school when I developed an eating disorder. And really interesting side note about that is the year prior to that, I was treated with antibiotics for acne. So now, you fast forward 35 years, there's much more research going on about the relationship between the gut microbiome and the brain and mental health conditions. So I just think that's a really interesting for people to be aware of. And I'm not saying never to take an antibiotic, but what I am saying is if you do, we want to make sure that we're replenishing the bacteria in our digestive tract, because of this relationship that happens between the gut and the brain. So for me, that connection was not made. And I basically continued on through high school and then into university. And then I found myself in my 3rd year in a place where I'd never been before, which was depressed and paralyzed by anxiety. And I was prescribed an antidepressant, which I took. And after a few months, I found myself in another place that I'd never been before, which was not sleeping. And I was spiraling out of control into a delusional, psychotic, manic episode. And it took 6 people to wrestle me into a straitjacket, and off I went to the hospital, where I was left in a rubber room, injected with a powerful antipsychotic called haloperidol, and then was diagnosed with bipolar disorder type 1. What I did with that was I pretty much shoved it into a place that I didn't want to look, and I didn't want anybody to know about that diagnosis, and I had a lot of shame around it. I continued basically marching forward in the world and really just did not acknowledge that was, or I didn't accept that diagnosis at all. And I started working, and then I've always been an overachiever. And that, I think, stems from I'm adopted. And so I think I overachieved in the world to kind of keep my place, to prove my worth, so to speak, not on a conscious level, but unconsciously. I think that was the operating message that was going on in me. So within 6 years in the corporate world, I reported to a CEO. But the problem was that every day I was wearing the mask that everything's okay, but I'm not actually doing that well on the inside. And it was a couple of years later where I had it's 25 years ago now, I had a suicide attempt, which left me in a coma with kidney failure. And I was on dialysis and told that I would need a kidney transplant. And while I was recovering from that, I realized I needed to figure out another way to navigate this journey that I was on, because I, up until that point, did not love and accept myself. I really was at war with myself, and I was hiding this piece of myself that I felt I needed to hide in order to be accepted. So through reading, a friend gave me a book to read called A Return to Love by Marianne Williamson, and she had a quote in that book on surrender, which goes along these lines, that surrender is not about fighting the world. It's about melting into who you really are and learning to love and accept who you are. And for me, that kind of hit me like a ton of bricks, because I really didn't realize this connection I needed to make about learning to love and accept who I was. Eventually, I ended up at a mental health regained public forum, and I heard a nutritionally oriented psychiatrist talk. His name was Dr. Abraham Hoffer. And I didn't realize that there was a connection between nutrition and diet, supplementation, and your mental health. And so I ended up becoming his patient. And after starting his protocol, I carried his protocol along with the psychotropic medication I was taking. And I think at that time I was taking 4 medications. So I carried those along for about a year and a half. And that was my best year that I'd ever had. And when I compared it to the 15 years prior to that, I felt free from depression and anxiety, and I had joy in my life. So I began to take stock of my situation. And I thought, this guy that I went to see, Dr. Hoffer, he was 80 years old. And I thought, this cannot be the only person in the country that can help people. I mean, there's lots of people that are struggling. And so that's when I decided to make a career change. So that's the 35-year journey in a nutshell for you.
Well, it's an incredible journey, like on so many different levels, because you not only found a way to, out of what so many people struggle to overcome in the best of circumstances, but you then turned that into your life's work now, and a series of books to help other people. So it really is an exceptional journey, and not many people will take the time to then go on and share this with other people. So I really do appreciate you being here. And one of the reasons, like I said, I've always loved the title of your book, Beyond the Label, because it's also what we talk about here at My Child Will Thrive, is that it's not really about the diagnosis. It really is about finding those underlying conditions that are causing these challenges with these kids, and the symptoms that we see, and the symptoms of anxiety, which a lot of these kids suffer from as well, depression, OCD. We see a lot of similar things of that nature. This is why the book that you've written, the work that you do, is so similar to what we do here. And I wanted you to be able to share that with parents so we can see how we can get to these root causes and really unpack what's going on with these kids and with the parents too, because a lot of us have similar challenges to our children and have medical histories not unlike what you're talking about.
I really think that the diagnosis or the label that you get is, it can be helpful at first to help you give some context or explanation around or validation to what it is that you might be experiencing. But what I really want people to understand, as you're saying, is that you can move beyond that, though, to this place of wellness and to this place of healing, and not to necessarily get stuck in that stigma, because I was stuck in it for a long time, and it was not a great place to be. For example, if you hurt your arm and you have a scab, you don't go around and call yourself a scab, right? That scab heals, and then the skin grows, and then it's gone, right? So the same can be true for these mental conditions that we often get stuck in. So I think that people need to sort of understand that difference.
Yeah, and you make a really good point. I mean, the diagnosis, especially when it comes to the kids too, it serves certain purposes in terms of access to service, understanding from others around us, so that they can start to begin to understand what's going on. And it does give us a place to start, at least when we first are figuring out what's going on with ourselves or our children. What do you think the 4 aspects of health that are important to address in your patient's overall health when you're first meeting them?
Yeah, so what I like to explain to people is that there's these 4 aspects that we need to consider. So there's the physical, the mental, the emotional, and the spiritual. Our Western system is focused primarily on that physical level. I think that if that's all you're going to look at, then you might miss 75% of the puzzle. And that's initially where I started. I started with that physical piece, with the nutritional piece that Dr. Hoffer put in place for me. But eventually, I had to then look at the mental, the emotional, and the spiritual side for myself as well. It got me so far. And for some people, that might be all you ever need to look at, is that physical piece. But for others, I think it's important, and I actually think for all of us, it's important to look at all 4 aspects. So those are the 4 areas.
So the one that probably most of our listeners are most familiar with, because this is what we do talk about the most, is that physical level. So let's talk about some of those things first, and then we can move on to the other ones as well. What are those areas that you feel most necessary to support on a physical basis when addressing mental health?
With naturopathic medicine, what we're always looking at is what's the root problem. And what we want to understand is sometimes there might be more than one root to a problem. So with respect to the physical level, what I want people to understand is there's 3 macro systems within your body. So you have the neurotransmitters, which are serotonin, GABA, norepinephrine, epinephrine, dopamine, glutamate, acetylcholine. In mental health, we're often focused on certain neurotransmitters like serotonin and GABA and dopamine. Then the next macro system we want to understand is the neuroendocrine system, or hormonal system. And that consists of the hypothalamus, pituitary, thyroid, ovaries in women, testes in men, the adrenal glands. Some people include the pancreas and the heart as part of the endocrine system as well. And what's really important to understand about the endocrine system is that every one of those glands that I just mentioned produces hormones. And imbalances in hormones can result in anxiety and depression and sleeping issues and eating issues and irritability. So we really want to tease out, is it both of those macro systems? And then, sorry, I should mention the third one before I go into that. So the third macro system is the organs of detoxification. So your liver, kidneys, colon, lungs, skin, lymphatic system, everything that your body makes, every neurotransmitter, every hormone, everything that you ingest has to be dealt with by the body and processed and eliminated. And if your organs of detoxification aren't working properly, if your digestion's not working properly, or you have something called leaky gut syndrome, or your liver enzymes are out of whack, that's going to contribute to inflammation in the body. And inflammation then contributes to this idea of the brain on fire. So all 3 macro systems, I think, are really important. And in my case, when I started with Dr. Hoffer's protocol, which was neurotransmitter based primarily, I would be suffering from most of the month. When I started his protocol, I was better for about 3 weeks of the month. And then, that week before my period, I wasn't doing so well. But I had no medical knowledge at that time. Now, with the benefit of hindsight and a little bit of knowledge, I can look back and say, oh gosh, my hormones were out of whack too. And so were my organs of detoxification. So in my case, I had to work on all 3 areas. But just keep that in mind, because it's really important for children especially. So for example, I had a case just the other day, this woman, she's 31 now, but things started for her when she was 12. So that's 19 years. And I asked her, well, when did you start your period? And she said, when I was 12. And I said, has anyone checked your hormones? No. And so she's been on psychotropic med after psychotropic med and not doing well for 19 years, but nobody's looked at her hormones. So from a root cause, we always want to ask, hey, what's going on at that time? And when you're between the ages of 9 and 15, or even 9 and 17, or 9 and 20, that's a real time of hormonal shift in the body. And so maybe we're looking at the wrong macro system because we're really quick to prescribe psychotropic medication.
That's a really good point, because a lot of these kids are, and when you look at the different macro systems that you have, the way you describe it, we see obviously imbalances in neurotransmitters. We see kids that are challenged in terms of their ability to detox. And then we do see that massive shift that happens. A lot of parents that have gains as when their kids are younger, all of a sudden have this whole regression period sometimes during puberty, because all of a sudden we're getting the involvement of the changing in the hormone system at that time. And when the imbalances are there to begin with, it just gets worse during that time. So it really does make a lot of sense the way you're positioning it.
Yeah. And I know, similarly, this isn't so much necessarily for children, but for moms, when you're now in your late 40s and early 50s, then we also want to bear in mind that there's another hormonal shift happening at that time too. And if you do notice a shift in mood, then that's something to take a look at the hormonal piece. Again, most doctors will prescribe you an SSRI, usually medication, but I think we want to look at, well, what's the right system that we need to be targeting here?
It is a really important point, because a lot of the moms that are listening to this are overtaxed because of caring for their children and dealing with all that. And we might just dismiss it as circumstantial in terms of, and you're going to talk about some of those other pillars too, which will be emotional and other ones, which may be leading into it, but we don't want to ignore the fact that it could be physical in nature as well.
And specifically that it's really connects to what's called the adrenal glands and the levels of two particular hormones, DHEA and cortisol. And if you're feeling like you've got no gas in the tank, it might be because you don't have any gas in the tank, right? And so that's just important for people to look into if they're feeling that way.
Yeah. So what do you feel the steps are to address the other areas, so the mental, emotional, and spiritual aspects of health? What steps do you typically recommend for those?
So teaching people how to manage their stress and looking at their thoughts and the emotional reactions that they have and how they generally behave and react in the world. Mm-hmm. And then ultimately also teaching them how to love and accept themselves, and wrapping that all up in this spiritual piece is important. So I teach a framework, first of all, in terms of managing the thoughts and the emotions, and from a stress perspective, called the 7 R's of working with problematic thoughts and breaking the thought emotion cycle. So a lot of people with mental health struggles are at the mercy of their mind, and they're not managing their thoughts very well. And I know for myself, this was huge. I was, like I had mentioned, I had worked on that physical piece, but then eventually I was bumping up against still this negative narrative that was going on within me, which would move me into a state of depression or anxiety. And I was taught how to manage my thoughts and using this 7R approach. So this is a combination of compassion-focused therapy, mindfulness-based therapy, and cognitive behavioral therapy. Mm-hmm. So the first R is recognize. So we have to recognize what is the narrative that's going on in our head. And if it's unkind or critical, or you're beating yourself up, or you're stuck in this negative dialogue, this inner critic has the stage, we need to refrain, that's the second R, from following those thoughts any further by relaxing into the breath and getting into what I call, getting into the gap, getting into the space between the thought triggering an emotion. Because what happens is we have a thought and it triggers an emotion, which triggers another thought, which triggers another emotion. And we just go round and round. And then we can spiral down quite quickly into anxiety and depression and suicide, and the list goes on and on. And in order to break that cycle, it has to start with this recognition of, well, what is the nature of the thoughts that I'm thinking? And if they're not serving me, then how can I stop that whole cycle from happening in the first place? And that's where relaxing into the breath is really important. So what I want people to understand is your thoughts actually create neuropeptides. The neuropeptides then affect the hormones that get produced, and the hormones that get produced affect how you feel. So it's a bit of a chicken and an egg problem here. I know for myself, this was difficult because, which is, well, I get to the next R here. So the first R, just to recap, is recognize, then refrain, then we relax into the breath. And then the fourth R is to resolve, to repeat this process. You're in mind training, right? If you were going to develop a toned bicep, you can't just lift one 20-pound weight and put it down and expect to have a toned bicep, right? You're going to have to practice. You're going to have to repeat that. So this is no different when it comes to training your brain. And think of your brain like that, like a muscle, but you got to guide it and train it and mold it into the direction that you want. And ultimately, this is the idea of neuroplasticity. Mm-hmm. So the next R is reaffirm, which is cognitive behavioral therapy. So what that is we take the thought that we recognized and we rephrase it. So that fifth R is reaffirm or rephrase. So say something else that is perhaps the opposite of what it was that you said you recognized. Now, for me, this was the hard part because I felt like if I was to say, the narrative often for me was, I am unworthy. So the rephrase would be, I am worthy. But the problem was, I felt like that wasn't a true statement for me. But remember, you don't have to believe it. The thoughts are still going to create neuropeptides, and this is going to create a more positive cascade, whether you believe it or not. Or if this is difficult for you, then just go neutral, which is I am, and don't fill in the blank. And saying I am is a very powerful statement, actually. So that's the rephrase step. And then the last two are reflect. So for me, I have stumbled so many times over the last, when I initially started off with my mental health at the age of 15, I'm now 52. So I have struggled a lot over these last however many years that is. I can't do the math right now.
That's not
37. Yeah, there you go. Anyways, so every time I reflect on the 10 steps that I talk about in Beyond the Label, the 10 steps are diet, sleep, exercise, managing stress. And then what we're just talking about now, right? Your thoughts, your emotions, the environment, spirituality. I look back and I say, okay, so what happened? Did my diet go off? Did I have an upset with someone? Did I stop doing the 7 R's? Like, what is the nature of my thoughts? Like, I really feel that there is an explanation for what you're going through. And it's just a matter of figuring that out. And then the last R speaks to self-compassion, which is reward. We need to be kind to ourselves and to support ourselves and to cheer ourselves on. So do something for yourself that, every time you do this process, do something for yourself, whether you're just giving yourself a pat on the back, whether you're going to schedule a massage, whatever it is you need to do. But it really speaks to this piece of compassion, which I think is also missing for a lot of us that are struggling with our mental health.
It's interesting that you brought up that really what it is playing into neuroplasticity, which we love to talk about here with respect to neuro rehab with the kids. And the reality is that us as parents can obviously benefit from this exercise so much because there is a lot of negative self-talk that goes along with the struggles that many of us have in terms of parenting these kids. But also I can see so many applications of going through the same process with our children because they are struggling with their identity and self-worth a lot of the times because they are, going through this world in a different way. And depending where they're at in their stage and recovery and development, they're starting to notice how people interact with them differently. having the opportunity to go through and do exactly what you're talking about and reframe the situation and reflect on and all the other R's as well, really could be beneficial to both them and us as parents as we're going through this journey. So I really appreciate all that.
Yeah, I mean, I really wish that someone had asked me, what are you thinking? Right? What are you thinking? And I'm who knows, maybe I wouldn't have been upfront about that because I'm not sure if I would have at that time, but I think it's important to ask your children, what are you thinking? Because a lot of times what they're thinking is just simply not true. And they're making it true for themselves, but it's really not true, which is another little Byron Katie's work. Have you heard of Byron Katie and the work?
No.
So that's her work, is she looks at the thoughts and she takes thoughts through a 4-question inquiry, which is, the way I say it is it true? Like 100% all of the time, in every aspect, is it true that you are whatever? And no, it's not true. Usually it's not true. Most thoughts examined under the lens of truth, and I'm talking these negative thoughts, aren't true. And so how do you feel when you think that thought? Well, I don't feel very good. But how do you feel when you don't think that thought? Well, I feel better. Well, then which thought are you going to think? So it teaches you to drive the train of your mind, so to speak, or drive the bus of your mind. And you're going to let the passengers on and off, i.e. the thoughts. And if there's some scary passengers on there, well, why don't we boot them off the bus? And let's bring on some more positive passengers, perhaps.
Yeah.
So that's another helpful little tool that people can start, using.
Yeah, I know it's a very helpful tool. And as you mentioned, it can be found in your book as well, which we will be linking on the show notes so that people can get a copy of that and work through it entirely for themselves. One of the things that you've mentioned is that you recommend people that are learning to trust their intuition and their heart when working through matters like this. I love that because I'm a big believer in going with your gut as a parent in terms of the way you parent and knowing what's going on with your child. Can you explain what you mean by that?
Most people are basically, we're living here from the neck up and we're discounting our body. And the heart, or the sense of intuition or gut instinct is in the body, right? It's not lying up here in the head. And so what I really like people to do is to learn to trust that voice of their heart. And there's an exercise that I take people through. I can take you through it if you're game.
Sure.
You want to be a guinea pig?
Oh, go for it.
Okay, so we'll do this. Okay, that's good. I'm glad you're brave.
Oh.
Yeah, no, it's pretty gentle. So all I'll get you to do is just put your hand over your heart. And people who are listening can do this along with us. Obviously, not if you're driving, mind you, but if you're at home cooking dinner. So and then I'll get you to close your eyes, and we'll just take a deep breath here. And I'm going to make a statement, and I want you to repeat the statement and then the answer that comes, okay? So the first statement is, heart, show me where you are.
Heart, show me where you are.
And just pay attention and see if you notice a color, a word, a feeling. And there can be nothing, and that's okay too. But just share what you may have noticed.
Green.
Nice. Heart, will you ever lie to me? Yes or no?
Heart, will you ever lie to me? Yes or no? My answer would be no.
Right. And heart, will you always tell me the truth? Yes or no?
Heart, will you always tell me the truth? Yes or no? Yes.
And heart, have I always followed you? Yes or no?
Heart, have I always followed you? Yes or no? Maybe not.
Maybe not. Heart, how do you feel when you hear I haven't always followed you?
Heart, how do you feel when I haven't always followed you? Betrayed would probably be the right word.
And heart, why do you feel betrayed?
And heart, why do you feel betrayed? Because I have your back.
Heart, can you forgive me for not always following you?
Heart, can you forgive me for not always following you? And the answer would be yes.
And heart, can you help me forgive myself for not always following you?
And heart, can you help me forgive myself for not always following you? The answer is yes.
And last question, heart, is it possible that you are my intuition dwelling inside?
Heart, is it possible that you are my intuition and dwelling inside? Absolutely.
There you go. That's it.
That's awesome.
So the quote I want people to remember is from Joseph Campbell, and it is, "The heart must usher the mind into the zone of revelation." So the way I interpret that is, we must lead our lives from a heart-centered place and then use the mind to figure out the hows of what the heart wants us to do. Most of us are doing it the other way around, right? We're living from the mind and we're discounting the heart. And then we get often stuck in pros and cons and fear and indecision. Whereas if we can just learn to quiet the voice of the mind with the breath, and that's where a regular breathing or meditation practice is helpful, and then learn to ask the question and then to see what the answer is that comes up for you. And I ask people to start with simple things here to build confidence. Just again, this is another muscle, so to speak, within us. So start with things like chicken or beef, right? Brown rice or quinoa. Like, nothing's going to happen. Nothing terrible is going to happen if you serve, right, a carrot dish over a broccoli dish tonight. Right. So or figure out, use it with your clothes when you're getting dressed, what brown pants or blue pants. I mean, just small things that are inconsequential. Not, no one's going to get hurt if you wear different colored pants.
Just your fashion sense or your feelings if your kids don't eat what you cooked that day.
That's right.
Yeah.
And then move on to the bigger type things. Right. But I was just going to say that I find this is really important because then when you do get that hit, like, call your mother or something is going on with my child, then you'll trust it more, right? Whereas a lot of people don't, we doubt it right now because the mind is usually the main, has the stage most of the time.
Yeah, I think that's an incredibly powerful message because, like you said, I've learned over the years to trust my gut, but it's true. Those of us that love to analyze everything from 6,000 different vantage points do get caught up in those pros and cons too much and don't follow what would be our intuition when it comes to our children or our lives in general. Yeah. So I really thank you for that. That was it's an excellent exercise and a great reminder. And I also think it's a great thing that kids learn these things so fast. And if you start them young, learning to get them to teach themselves to trust their instincts as well and doing that exercise with them, it's amazing how they can carry that throughout their lifetime. So I have to thank you so much for your time today and for sharing your story and your work with us because it makes such a huge difference in so many people's lives. And I hope to have another conversation with you about more things in the future.
Yeah, that sounds great. Thank you so much for having me. It's been so much fun.
My pleasure. And remember everybody to check out the show notes on the My Child Will Thrive website so that you can get links to where you can find Dr. Chris and all of her books that she has. She has actually the book Beyond the Label. You also have a Beyond the Label journal, I believe, and a cookbook. And the cookbook's name again is?
That's The Essential Diet, Eating for Mental Health. Yeah.
Fantastic.
I'll show you, there's the Beyond the Label.
Oh, it's such a beautiful book too.
There you go.
It's wonderful. So thank you so much again for taking the time to be with us today. And I look forward to talking to you again soon.
Thank you. Take care.
So that's a wrap. Thanks for joining me this week on My Child Will Thrive. I'm so passionate about giving you the tools and information you need to help your child recover. And as they say, it takes a village, so join us in the My Child Will Thrive Village Facebook group, where you can meet like-minded parents and stay up to date on everything we have going on at My Child Will Thrive. This is Tara Hunkin, and I'll catch you on the next podcast or over at mildchildwillthrive.com.